How do you interpret breast cancer receptor status? Understanding breast cancer receptor status is like decoding a secret message that guides treatment decisions. When doctors diagnose breast cancer, they test the tumor tissue to see if it has specific proteins called hormone receptors. The main ones are for estrogen and progesterone. These proteins are on or inside the cancer cells and can bind to hormones in the body, which can help the cancer grow. Knowing whether these receptors are present helps doctors figure out the best way to treat the cancer. The most common test used is called immunohistochemistry. It stains the tumor tissue to reveal if hormone receptors are there. The results tell us how many cancer cells have these receptors, how strongly they are expressed, and sometimes give a score to summarize the findings. For example, if at least 1% of the cancer cells show receptors for estrogen, the tumor is called estrogen receptor positive. The same applies for progesterone receptors. If the tumor has either estrogen or progesterone receptors, it is called hormone receptor positive. If neither receptor is found, then it is hormone receptor negative. This receptor status is very important because it influences treatment options. Hormone receptor positive cancers usually respond well to hormone therapy drugs like tamoxifen or aromatase inhibitors. These medications block or lower hormone levels, helping to slow or stop cancer growth. On the other hand, hormone receptor negative cancers do not respond to hormone therapy and often requiring other treatments such as chemotherapy or targeted therapies. Sometimes, the percentage of cells with receptors is low, between 1 and 10%. These are called low-positive cases. While they may have less benefit from hormone therapy, they are still often considered candidates for it. It's also important to remember that receptor status can change over time. If the cancer recurs or spreads, doctors might retest the tumor because the receptor profile could be different from the original tumor. This helps ensure the treatment plan stays effective. Receptor status is also evaluated alongside other markers like HER2 to classify breast cancer into subtypes. These classifications help tailor treatment plans further. Always remember that interpreting these results requires considering the whole pathology report and the individual patient's situation. In summary, understanding receptor status involves looking at how many cancer cells have hormone receptors, how strongly they express them, and what this means for choosing the right treatment. It's a vital part of personalized cancer care, and discussing these results with a healthcare team ensures the best possible approach for each person. For accurate interpretation and personalized advice, always consult your medical team.